really look into the workload of our nurses. And I ask this also because the nurse-to-patient ratio that we shared previously in Parliament of 1:4 to 5 seems quite far from the reality on the ground. Many nurses are sharing that they're looking after way more nurses. Second, I do agree with SPS, maybe we shouldn't be that prescriptive, but a lot of nurses are now sharing that they only have 5 hours rest between shifts. And I fear, not just for the nurses, but also the level of care that patients will get for someone that's overworked. And so I hope MOH again can review the rostering system of the hospitals and also the nurse-to-patient ratio. Thank you.
Mr. Speaker, I thank the member for his question, and I appreciate the concerns he has for the nurses and the healthcare workers in general. He's raised many questions in this House relating to their workload and the things that they have to address in the realities of the ground today. But I'm sure he also appreciates and understands that it is a post-pandemic situation. It's a pandemic situation that we're dealing with, and these are the realities on the ground. We also have to be cognizant that we not only have to ensure that the nurses are taken care of, we also need to ensure that the patients are taken care of. So in the light of the context that we are facing today, these are the realities on the ground that we have to acknowledge and learn how to manage. We have accepted that there are some difficulties, and I've explained in previous sittings in response to Mr. Louis Ng's questions about the efforts that we've been taking. There has been a staff wellbeing committee that was set up to look into different areas and different aspects of the work and to see how we can improve and fill in some of these gaps. We have set up a task force looking at issues relating to abuse of healthcare workers. We have also the work group looking into the issues relating to the junior doctors, and this is a holistic effort that we are taking into account. So one aspect of it is really the managing of their workload, but this is something that we need to leave to the hospitals and the public healthcare institutions to manage. It's an operational setting, and setting too much rules does not help, and it will be counterproductive. The reality is, even if we set the rules, the professionals, even if they're going to leave their shift, if they see a patient that is unwell, they would also still stay and still want to take care of the patient. And I think this is the reality that we have to accept of the nature of the work in the healthcare sector. That notwithstanding, I think we appreciate that it is a challenging time. I've explained just now and also in earlier sittings that we're looking at this from a multi-pronged approach. We are looking to see what are the areas where we can augment the work with regards to maybe having technology, employing more people to help with the administrative load, looking at how we can augment workers, the workforce with foreign nurses, looking at how we can actually also get families and caregivers to understand where they can alleviate the load of the nurses. So these are all the efforts that are being put in place. We appreciate the concern and care. Issues that Mr. Louis Ng has raised are issues that we are cognizant of, and we are taking steps to try and address it.